This is Dateline Wyoming, produced in the studios of WyoRadio. Dateline Wyoming is a weekly news feature highlighting community issues and events that shape our lives here in Southwest Wyoming. In-depth analysis and interviews with the people behind the headlines. Views and opinions expressed on this program are not necessarily those of WyoRadio ownership, management, or those of our sponsors. Time will be made available for responsible dissenting opinion. And now, Dateline Wyoming.
Mental health issues are in the news as our society struggles to address the problems associated with those in our communities who are facing a daily battle of living in the turmoil of a mental health crisis. Here in Wyoming, Title 25 addresses the issues for those who require court-ordered treatment. Today we begin a two-part series concerning the issues surrounding Title 25, funding, resources, and facilities. Join us now as we explore the complexities of Title 25 in the state of Wyoming with our in-studio guests, Mike Bauer and Linda Acker of Southwest Counseling. Title 25 on Dateline Wyoming, following this message from our sponsor, Northern Title Company. Good deeds done daily.
Remember when your word and a handshake sealed the deal?
Those were the days.
It's just not the same anymore, but Northern Title Company exemplifies professionalism and old-school customer service. You have a choice when it comes to title work. Northern Title makes it simple for you. They know how important it is to have everything in order. Walk away with confidence knowing Marianne and her staff have completed your title work thoroughly. Visit Northern Title Company, 2620 Commercial Way. Good deeds done daily.
Linda Acker is the Executive Director of Southwest Counseling, and Mike Bauer is the Manager of Mental Health and Emergency Services at Southwest Counseling. Let's just start off with some basic information on Title 25. What is it, and what is it intended to do?
Title 25 is actually similar to statutes that exist in every one of the United States. It really has been around since the 80s, the early 80s in Wyoming, and has been revised a couple of times. Recently revised again, actually, in 2016. It allows us to hold someone in a hospital-based setting where they can get some emergency care. And the intent of this whole law is to help them stabilize and be able to go on and maybe access then outpatient care. In many instances, if they have made, for instance, a suicide attempt, outpatient care may not be sufficient, and they do sometimes go on to involuntary psychiatric hospitalization from there.
There are social implications as well as in terms of relation back to family violence and those types of things, aren't there?
Definitely there are. When you are dealing with a person who has been detained, we're hopefully also dealing with family members. And so when our therapists are involved in that situation, we'll be talking to family if appropriate, and we will be looking at the lowest level of care for the person who's detained, but how can we assist family members and other caregivers with the individual?
As I've been looking at some of the information available on Title 25, it seems that some of the issues right now are more involved with funding and also with some definitions as to who is going to do what and where that's going to happen.
In the last 3 years, funding has been a major problem for Title 25. There's been an increasing cost associated with it, and right now for the biennium, the Department of Health is looking at a $20 million shortage. And as community mental health centers and substance abuse centers across the state, we're very supportive of the Department of Health receiving that money, since the other place that they could look for the money is in our own budgets. And we believe as community mental health centers, we're doing what we need to do in the community to divert a number of people away. So there is a concern because of the monetary cost associated with Title 25.
And this is a multifaceted issue as well as that. It touches a lot of different areas, doesn't it?
Well, we have a number of different Title 25 partners in when an emergency detention takes place. You have the county attorney, you have the prosecuting attorney, you have the district court judge, you have hospital personnel, and of course you have family members if they're present and if it's appropriate. And then you have the nursing and hospital staff and Southwest Counseling that you're working with. So, and then you may or may not have a cooperative patient to deal with.
And in addition to that, then there's a facilities issue and transportation issues that come into it, aren't there?
For Title 25, there's designated hospitals that are psychiatric in the state of Wyoming. The primary one in southwestern Wyoming is the state hospital in Evanston, Wyoming. But there's other psychiatric hospitals that can be utilized for their beds. One is in Lander, which is Pine Ridge. The other one, which is WBI in Casper, Wyoming, and then Cheyenne Regional in Cheyenne.
Walk us through the process of how this would work in a typical situation.
Perhaps a family member has come to the attention of their family. Lots of times it's actually through a suicide gesture. They have then perhaps called the ambulance or the police department and been transported up to the local emergency room. And much of this work actually does take place in local emergency rooms across the entire state. What happens at that point in time is that the doctor will ask us to do a consultation to try to talk with the person and do a formal suicide assessment. And as the mental health professional feels that that person is in imminent danger, that there's some continued suicidality there, we, at that point in time, institute, in conjoint cooperation with the hospital staff, we institute a Title 25 document that holds them in a safe room for a 72-hour period, during which they can continue to be, of course, evaluated again, and hopefully during that 72-hour period, it can provide some stabilization. If not, then we proceed on to a hospital-based court hearing where the individual is, at that point in time, we consider imminent danger and we consider involuntary hospitalization then.
Let's talk a little bit about the legislature's involvement in this. Where does that whole package stand right now as far as legislation goes?
The governor last year appointed a select committee on Title 25, and they met for approximately a year, and Mike and I attended the majority of the Title 25 meetings. And out of Title 25 came some changes to the bill. And one of them was increased utilization of convalescent leave, which is once you are detained and you go into a hospital, rather than just releasing you back out into the community, you're on convalescent leave. And if you have a problem and you need to be re-hospitalized, you don't have to go through the entire process. Southwest Counseling would call up the state hospital and say, this individual's having a problem, and then that person would go back to the state hospital. So that's a real plus, because we can just bypass the emergency detention and involuntary, and the person receives inpatient hospitalization much quicker. The second avenue is what's called gatekeepers, and a gatekeeper can be designated in each county. There's a single entity responsible for the Title 25 process in each county. Southwest Counseling's applied for a grant, and I believe that the Department of Health, Director Forsland, will appoint us as the gatekeeper, and the county commissioners recently provided Southwest Counseling with a letter of support to become the gatekeeper. And my viewpoint of the gatekeeper is you have a lot of responsibility, but very little authority. So the gatekeeper is and it is an attempt by the state to reduce the cost of Title 25. They want to reduce the cost of people going to hospitals that should not be going.
Is it more of an individual advocacy situation, or what are the gatekeepers' responsibilities more specifically?
I think the primary responsibility is to follow the individual once they enter the Title 25 process throughout from admission to discharge, and to determine if there is a lower level of care that can be provided for the individual. We've been doing this for years. I think for FY16, Southwest Counseling did 301 emergency assessments. And out of that 301, 84 people went to involuntary hospitalization. So we diverted 217 people away from being hospitalized, which is the majority of the patients we're seeing.
It's an attempt to make sure that people just don't get lost in the system and that the system is actually being effective and addressing their needs.
It does follow somebody from the beginning to the end, and it tries to help the level of care meet their level of need. Theoretically, that would be the best care that would be available. It would also save money at the same time. For instance, one of the things that we do that some of the other folks across the state that have been doing these types of evaluations don't do or are starting to do now is we've always coordinated very closely with the emergency room doctors and the doctors at our local hospital here to be able to try to get the best kind of disposition, even get some medication going, to be able to really, really help this person in a really intense way. And the gatekeeper's role would be really to encourage that kind of thing and to try to get people into the best care they can.
But the legislation sort of defines the role and responsibilities of the gatekeeper?
It defines it from the beginning to the end with the idea that it will save money, but that it will also coordinate care, and that there won't be a bunch of moving pieces, so to speak. There'll be more or less one single point of service that can coordinate some of the various moving pieces, including giving advice to the judge. Following someone when they come out of the hospital is also an important piece, making sure that they don't go to the psychiatric hospital and then, boom, they're back in your community and no one's following them. No one's helping them. The gatekeeper actually follows on that end of the service as well.
What we're talking about is a very coordinated regimen of care and follow-up for these people.
Yes, it's a coordinated evaluation. It coordinates treatment. It coordinates treatment decisions and then follow-up, as you said.
Dateline Wyoming is sponsored by Northern Title Company. Good deeds done daily.
When you buy or sell a house or property, you have a choice in real estate agents. When you're ready to close on that real estate transaction, you also have a choice in your closing company. Northern Title has been servicing Sweetwater County for many years. Their experience can make your closing time quick and hassle-free. So tell your real estate agent your choice at closing time is Northern Title, 2620 Commercial Way, Rock Springs. Good deeds done daily. Northern Title.
We now continue with Dateline Wyoming and our guests, Linda Acker and Mike Bauer of Southwest Counseling Services. Natrona, Fremont, and Sweetwater County are primary counties that are involved in some of this. Can you speak to that just a little bit as to why that would be?
For Natrona County, they're ranked number one in the state for admissions of emergency detention and involuntary hospitalizations. The reason for that is Natrona County takes a number of detentions from surrounding counties. So they're not only servicing Natrona County, they're servicing a number of counties. And years ago, Sweetwater County attempted to do that, where they would send people detained up to Natrona to be processed through the emergency detention. We haven't done that for years, and it's more beneficial to the patient to stay within their community. So it's understandable why Natrona has such a high number, because it's just not Natrona. Now, Sweetwater County, we've been asked that question, why are you second in the state? And we believe it's because we're doing a remarkable job, and we are also servicing surrounding counties, because our hospital does do emergency detentions, and there are a number of hospitals in the state that will not.
As much as anything, it's the fact that we're recognizing and addressing the problem rather than the fact that it just isn't here.
I think that's really true, Tom, because one of the things that's been lost a little bit in some of this Title 25 discussion is that, in various parts of the state, Casper, Cheyenne, Laramie, and Rock Springs, the consultations to the emergency room on these types of situations has pretty much tripled in the last 3 years.
Is the issue in Fremont County Native American population?
I don't know the answer to that, Tom. I would imagine that there are some folks that are Native American. I mean, Native American is a specialized population in terms of suicide risk. because of some of the lack of resources involved with that particular population, and sometimes their resistance to actually using some traditional resources too. But I don't know the answer to that exactly.
Society has made some huge steps forward in recognizing and dealing with mental health issues. It seems to me that this is an attempt to really take it one step forward from that, is it not?
I think there has been remarkable gains in the last several years with people being less stigmatized because they have a mental illness and wanting to receive help. I also believe that we have limited psychiatric opportunities in the state of Wyoming. People do recognize that they do need help at times. Family members recognize it. And it really does take a continuum of a team, and that psychiatric component for medication is critical. And there is definitely a lack of psychiatric professionals in the state of Wyoming. There's a high concentration in like Cheyenne, Casper, but in Sweetwater County, we have, I believe, 2 psychiatrists right now at the local hospital, and then we have a nurse practitioner who specializes in psychiatric at Southwest Counseling. But, that's really small for the size of our area.
Looking at where we are right now with Title 25, do you feel like that adequately addresses the situation, or are there things we need to add to or to be doing in addition to that?
Well, I think one of the components that's really been looked at are the community mental health and doing their jobs in their communities, because we do receive funding from the Department of Health. And I will maintain that we are diverting the majority of people away from Title 25. However, people are going to need to be hospitalized, and we need a psychiatric facility for those individuals to go to. I do think once a person enters the hospital, then you need to be able to have some outcomes and to monitor the effectiveness of the treatment. And that's going to be an important component to also look at.
Recognizing, of course, that Title 25 is specifically designated for court-ordered hospitalization.
Yes, that's correct. It is designated for that on the sort of the back end, of course. The first part of Title 25 can be that emergency hold in communities, though. And that emergency hold, that 72-hour hold that takes place in communities, before a hearing takes place. That's what counties grapple with, the expenses of that, because counties wind up being responsible up until the person is ordered into psychiatric hospitalization. Okay.
And coming at a time when economically budgets are all under pressure for funding.
Oh, absolutely. An important part, actually, of this whole emergency services is that we do emergency outpatient services 24/7, 365 days a year through our center. And we also have developed an in-between the hospitalization and regular outpatient care. We have a crisis stabilization program that can often help people to actually stay out of the hospital or keep them out of the psychiatric hospital, because we're able to provide pretty intensive care through that program.
Other issues you see as it relates to Title 25?
Every partner in there has a different need and a different goal. And we do have so many partners with Title 25, as I said before. But I think you cannot forget the person we're serving, and that is the patient, and what is in the best interest of the patient. At the state level, we often hear that everyone's to have insurance today. Well, what we find in Sweetwater County, especially going through the emergency detention process, a very limited number have insurance. The great majority are not covered by the Affordable Health Care Act at all. So that's where the rub comes in, is who's paying for the cost of Title 25. And it is the taxpayers through either the county or through the state, because they don't have the resources and they don't have insurance.
Perhaps there's a need for some legislation as far as the insurance requirements or the health care coverage in that area?
Right now, what we need, with the $20 million shortfall by the Department of Health, I'm hoping that the legislators will find opening up their rainy day account or find some money for Title 25 at the state level and not through their community systems such as Southwest Counseling, because we do provide the community system, but you can't keep taking money away and expecting the same results and the same services.
This whole area could be considered a priority because of the fact that so many other issues stem from it.
Right. And I think when you have an economical downturn that we're experiencing right now, Tom, there are a lot of people that are going to experience high levels of stress. And they are going to be tapping into services such as Southwest Counseling. And when we do have people coming into Southwest Counseling, we not only look at their mental health needs, but we're attempting to look at their whole health needs. So what else can we do as a community to provide support and integration into the community to make them more successful? So it may be we connect them up with school, we connect them up with employment opportunities, we get them to a healthcare provider, because oftentimes these individuals have multiple healthcare issues. And so we're looking at the whole individual and just not dissecting them and saying, we're just going to take care of your mental health problem if it's depression. There's a whole person there that we need to address.
You've got partnerships that go way beyond just the mental health care.
Absolutely. We have great case managers at Southwest Counseling that will connect them up with a variety of different services and resources. That's important. Housing is a critical issue for people who have a serious mental illness. The housing cost throughout the state, but especially in Sweetwater County, continues to be very high. And most people who are on disability checks, to pay $600 or even $500 for housing does not leave very much money to purchase food with or to do their utilities. So housing is a critical component to living well.
So in many cases, you're acting in a capacity of referral and facilitation.
Wyoming is just a small town. So we do know our other partners in other areas, and sometimes we receive what they call step downs from the state hospital. A person's been hospitalized at the state, and there's no available beds to go back into their communities, because some people need 24-hour care in group homes when they come back into their communities. So Southwest Counseling will take those individuals into crisis stabilization, and until there's a bed in their own communities, they will stay with us. But in the meantime, we're working with those partners to get the person returned to their own community.
Do you see a real critical shortage of beds?
Yes, I do. We only have one group home in Sweetwater County, and we probably could fill another group home very easily. And we do have assisted apartments for people who are have a mental illness, and they're filled to capacity at all times.
Are you seeing people from out of this area?
We actually are seeing more local people, but we're also seeing more people from out of county. Rock Springs tends to be sort of a feeder for healthcare as well. I mean, people travel long distances to come to see the doctors and to come to the hospital here, and they do the same for mental health care sometimes. And we do wind up to a certain extent taking care of some of these emergency clients that live elsewhere.
Legislatively, is the funding issue the most important thing that you see that the legislature can do to help work with this problem?
Well, I think there is legislation, Title 25. The legislation was done last year with convalescent leave and with a gatekeeper, and then there was another aspect called directed outpatient. And directed outpatient hasn't been utilized in Sweetwater County, but that's where an individual would remain in the community, but it would be as if they would be hospitalized, but it's involuntary, that they would have to follow a treatment plan. They would have to adhere to what the treatment provider is recommending. There is an issue of once they're released from the the hospital, who's going to follow that individual to ensure that they are doing what they need to do according to the treatment plan? Because the one key that we've always got to remember is their civil rights, because we all have civil rights. And that is going to be a key component, because once they go on directed outpatient, if they don't follow, then they can be hospitalized.
Final thoughts.
For me, I think what's critically important, as a director of Southwest Counseling, psychiatric care is just critically important to providing medication and providing a good treatment team. I think that the legislators are going to have a lot of challenges this coming session, and I'm hoping that they will really value what the community mental health centers have been doing, not only in Rock Springs and Sweetwater County, but throughout the state of Wyoming.
Mike?
I would also, I suppose, add that I think that one of our viewpoints is, of course, that mental health care is every bit as important as health care. This state, in a sense, is having a real rise in its mental health care needs. And I'm hoping that everyone understands that our staff are a little bit like umpires. We have to call it as we see it. If we see that someone really needs emergency care, we have to provide that, and we try to provide it. And I hope that everyone understands that care goes along with some funding needs.
Our guests on Dateline today have been Mike Bauer and Linda Acker from Southwest Counseling. Thank you for coming in today.
Thank you.
Thank you, Tom.
You have been listening to Dateline Wyoming. Today's program has been part one of a two-part series on Title 25. Next week, our guest will be John Hastert, representing Senate District 13 from Sweetwater County. We'll explore the legislative issues regarding Title 25. Join us next week at this time for Dateline Wyoming, sponsored by Northern Title Company. Good deeds done daily.
Northern Title Company knows that most of us don't like paying capital gains tax every time we buy or sell property. We want to keep what we've worked so hard to acquire, but we may not know how or where to find the answers we need. That's why using Northern Title, an experienced and qualified title company, is the answer. Stop in today at 2620 Commercial Way in Rock Springs. Northern Title Company. Good deeds done daily.
You have been listening to Dateline Wyoming with your host, Tom Ellis. Dateline Wyoming is a public affairs presentation of WyoRadio News, presented every Sunday at this time, highlighting community issues and events that shape our lives here in Southwest Wyoming. Views expressed on this program are not necessarily those of WyoRadio ownership, management, or that of our sponsors. Time will be made available for responsible dissenting opinion. Audio copies of this program will be available each Monday following the program's airtime on Sunday at youtube.com/WyoRadio.